mercies and blessing all the time in this world until we can gather in this admirable place without any trouble and obstacles. Today, in this very special afternoon, such an honor for me, Hilda Ramadhani Fauzia, to be standing here and welcome each one of you in this very special event. We proudly present the Stadium General. We bring the theme for Stadium General today, Interprofessional Education in Healthcare. All right, ladies and gentlemen, in this very special afternoon, we'll have several agendas. So without any further ado, let's open our event today by reciting Basmalah and pray together. Bismillahirrahmanirrahim. The next agenda is welcoming speech, which this time will be delivered by Mr. Taufikur Rahman, PhD, as the Vice Rector 1 for Cooperation and Academic. For Mr. Taufikur Rahman, time and place are real welcome.
Okay. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillahirabbil alamin. The Honorable Prof Lisa McKenna, Ibu Cesa, and all of the students in the Faculty of Health Sciences, Universitas Aisyah Yogyakarta. I think this is a very good opportunity. It's really great honors, to welcome our guests from Australia, Professor Lisa McKenna, to our university, because we are currently organizing international conference, and we also would like to use the opportunity to have Stadium General, to have a lecture for all of the students in the Faculty of Health Sciences, Universitas Aisyah Yogyakarta. So on behalf of the Rector of Universitas Aisyah Yogyakarta, I would like to thanks to Professor Lisa McKenna for your time to visit Odisha for the, I think this is the second or the third time. The second time, the second time you visit this university. And also Ibu Cesa, who will become the moderator for this session. And I really hope that all of the students can use the opportunity to learn from the expert with the topic today is about interprofessional education in healthcare. So you are come from different background of healthcare profession. There are midwives. I know there are some also nurse student and also student from our field of health studies. So this is, I think, very good opportunity for you to learn about interprofessional education, and also the opportunity for you to improve your English. Anyone have been to Australia before? Yang sudah pernah ke Australia? Oh, belum. At least you can meet Prof Lisa, and hopefully in the future, you can have the opportunity to visit her in Melbourne, in Australia. Okay, I think that's all my introduction for this lecture today. And again, please use this opportunity to learn from Professor Lisa, and you can ask questions. You can, if you have question, please don't be hesitate, don't be afraid to ask questions, because I think this is a rare opportunity for you to have this I think such wonderful experience. Okay, I think that's all for my introduction today. Thank you very much for your attention, and I give time to Cesa to moderate this forum. And I apologize for Professor Lisa because I cannot accompany you in this forum because there are also another meeting. Okay, thank you very much, everyone. Nasrun minallah wa fathun qarib. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam. All right, thank you so much for Mr. Taufikur Rahman for the great welcoming speech. All right, honorable audiences and all students whom I really appreciate, the next is main agenda that we have been waiting for. We are fortunate today because we have a great speaker for our Stadium General, And we will be guided by our moderator to listen about the lecture and discuss more in the question and answer. Moving right along, I will
Selamat datang semuanya mahasiswa Fakultas Ilmu Kesehatan. Di sini ada program studi keperawatan beliau kaitannya dengan building healthy community, kemudian riset-riset yang terkait dengan keperawatan, simulasi pada pendidikan keperawatan, serta teaching and learning ya, dan juga memang banyak sekali publikasi-publikasi beliau khususnya dalam bidang keperawatan dan juga kebidanan. Menunggu waktu lama, without any further ado, kita akan memulai mendengarkan perkuliahan dari Ibu Lisa. Anda boleh manggil Ibu Lisa juga boleh gitu ya. Dan silahkan tadi seperti yang disampaikan oleh Pak WR, Pak Warek untuk memanfaatkan sesi ini semaksimal mungkin. So for Ibu Lisa, over to you Ibu Lisa.
Terima kasih Bu. Selamat siang. Today, I've been asked to speak with you about interprofessional education, and it's a real pleasure to be back at UNISA. It's my second visit here, and Trobe and UNISA have an agreement to work together, and so we're spending some time here and learning to work together on research and other things. So it's a real pleasure to be back in Yogyakarta. I've been here many times, but it's beautiful and I love to come here. Saya perawat dan bidan, so sedikit interprofessional. I'm both. And it's not unusual in Australia to be a nurse and a midwife. So I share midwifery, I share nursing, and both. So I know in Indonesia that's a very unusual thing, but until the year 2002, it was not possible to be a midwife in Australia without being a nurse first. So it's changed now. So that's a good thing. So today I'm going to talk about interprofessional education. And in some ways, you're already doing it. You're sitting here together and you're going to be learning together. And so hopefully you enjoy this session today and you get to take away something new. And I get to learn from you as well. One thing, you have to keep learning. So I always learn from the questions that you ask and from your experiences. So hopefully we can have a really good session this afternoon. I'll work this. Okay. So a little about where I'm from, and I'm from Trobe University in Australia, in Melbourne. Anybody been to Melbourne or know where Melbourne is? There some hands up there. Yay, someone's been to Melbourne. Very multicultural country. Well, the whole country is very multicultural, but Melbourne's a very multicultural city. In Australia, most people don't look like me anymore. Once upon a time, there was lots of white Anglo-Saxon people, but now we have a very different mix of population, and we have people that come from around 300 different countries that call Australia home. So for health professionals, that really creates a lot of challenges. If we're going to provide person-centered care that is sensitive to a person's culture, understand what their culture means in a healthcare setting. So it's a very challenging place to work, but it can be very beneficial for everybody to learn a bit about each other. So this is Australia. Australia's almost as big as Europe. It's a very big country, but it's very empty. Our population is around 25 million people only. And I can't look. And the population lives mostly down here and around here. And in the middle, it's all gurung. It's all desert. So it's a very different place. Melbourne is down the bottom here. It's where I live. It's where I was born. 4 seasons. And at the moment, it's quite cold. We're coming from winter into spring, and there's many floods. And a lot of the whole state here is flooded, which isn't very good. Anyway, so I'm going to, this is the state of Victoria. So if you see up here, you can see that that's the state. We've blown it up. These are all the campuses of Trobe University. This one here is our city campus in Melbourne, but we also have a number of campuses in the rural area, and most of this is flooded right now. So many of my colleagues are fighting floods, which is not very nice. Anyway, we'd love to see you in Melbourne sometime, and we'd love you to come and visit La Trobe. This is our Melbourne campus. It's a very pretty campus, very big campus, lots of green, lots of parks, and you can see the city of Melbourne just at the top here. So we sit in the north of Melbourne. Very pretty, lots of nice buildings and parkland, and we even have kangaroos. Okay, that's a bit about La Trobe. So now I'm going to talk about some of the reasons going to talk about interprofessional education, and I'm going to talk about why we do it. So in the world right now, there's so many challenges for health providers. Health professionals are faced with all sorts of things, and you know about many of them here. So there's lots around the world, there's many humanitarian crises and conflict, which means there's lots of refugees, from country to country. In Australia, and there's lots of natural disasters, again, which are not uncommon in Indonesia. Around the world, we're facing aging populations and growing chronic illness. Because people are living longer, we're seeing more chronic illness, but also because we're able to care for people in a better way. Medical advancements, technologies, new medicines mean that people can live longer with chronic illness. We've seen a lot more mental health issues, first with COVID-19, but we're seeing a lot more mental health. We're seeing a lot more enhanced health services. We're moving from country to country. And so we're becoming very global as a workforce. We're also using a lot more technology. And as you know, technology is improving and increasing all the time. And so we need to be able to stay on top of the technology and to be able to use it to help us care, but not replace care. We also have better informed patients sometimes. So our patients are they're looking at the internet, they're getting health information. They know what to expect from their health professionals. They know what they want, and they have expectations of us. We also know that some of the information they get is wrong because the internet has lots of bad information as well as good information. There's also a bigger focus nowadays on patient safety and the responsibility of health professionals in ensuring a safe environment for patients where they don't end up sicker than what they started out. In countries like Australia, their patients will sue health professionals if they're caused injury. And that's very much the case in America as well. We're starting to see that happen around the world, is that patients will sue if there's a problem, if something's gone wrong and somebody's to blame. So we need to make sure that we're providing quality care and we can stand by the care that we're providing. In addition, we're seeing lots of new health professionals coming along, new roles that weren't there once upon a time. And so somehow we have to all work out how to work together and who does what to provide the patient care. And that's part of the reason their care. So they're part of the team. We find also that patients from very diverse backgrounds can be cared for more appropriate to their culture. And when you have people from 300 different countries living in your country, you need to understand each person's individual cultural background. But we also find that when people work better together, we use people's time more efficiently. For health professionals, there's a lot more satisfaction because you're seeing patients go home well and quicker. You're seeing an emphasis on prevention rather than just treatment. It enables health professionals to learn new skills and different ways of caring, encourages innovation, and it allows each healthcare provider to focus on their special part of the care. So there's less overlap and less of different people trying to do the same thing. So it's much more coordinated. And overall for the health service, there's more efficient care, better use of resources and less errors, better patient outcomes, and that's important for hospitals when they have to report to governments. So what makes a really good healthcare team? Some authors got together and they did a study and they found 10 things that are really important with interdisciplinary or interprofessional teams. In that there's shared leadership and management, good communication, there are personal rewards from working in the team, there's appropriate use of resources, there's the appropriate skills. So you'd bring in the skills that you needed depending on the patient's problem. There's a climate of trust. Everybody is valued and treated equally. So there's no hierarchy in interprofessional teams. That there's clear vision, there's quality and person-centered focus, and there's respect of each other. And interprofessional respect is key. However, that's very ideal, and I know you know that there are a lot of challenges faced by people working in healthcare and about health professional teams. That it can be time consuming to work well together, and people are often in a hurry and trying to rush, so they just do their bit and run away. It's difficult to manage schedules of people together, that we need time for communication, that we might actually need more services and resources to efficiently run our team. It requires ongoing review and work, and each team member needs to be committed to the team. If one person isn't, the team can crumble. So, this is where interprofessional education comes in. There's a whole philosophy around interprofessional education that health professionals won't learn to work together if they don't learn together. And that's the whole premise of interprofessional education. Very traditional education was very siloed. Medicine would sit in one building, nursing would sit in another building, and the other health professionals separate, and they would never interact. So they never understood each other. So the whole idea about interprofessional education is that by learning together and learning about each other's roles, as health professionals, people will work together better. And it sounds very logical. So back in 2010, the World Health Organization made this a priority. It decided that there needed to be a guideline for interprofessional education, and there needed to be a roadmap internationally for this to happen. So they released a document, you can see it here, you can get it on the internet, it's publicly available. And they said that interprofessional education is when Students from 2 or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes. In their document, they had a little pathway I've got here in front of you. So as students, they engage in interprofessional education, they become ready to collaborate. So as graduates, you've worked with other health profession students, you know what they're about, you know who they are and what they do. It means that as a health workforce, we're better prepared to do interprofessional work. It means that we collaborate to provide patient care and we provide the best health services for patients. So ultimately, it promotes interprofessional collaboration, teamwork, and joint decision-making, and encourages, it almost forces the professions to work together. It also builds respect of the integrity and the contribution that each profession makes, and that learning experiences are built by the academics of all the professions. So the situations and the scenarios are not written by one profession, they're written by all the professions together. You're able to move it? It won't move. Thank you. So as a result of interprofessional education, we see better teamwork, better communication, better collaboration, better awareness of each other's roles and scope of practice. So you know where and what a nurse does and where the doctor starts and where the doctor passes over to the nurse and vice versa. We have more seamless integrated healthcare and better quality of healthcare. And importantly, we have better patient satisfaction. And we need to remember that we're actually there to serve patients and to meet their needs. And sometimes we need to think of ourselves as a bit of a provider, like you would look for services anywhere else. We often forget that we're there to provide a service. So I want to talk about a few examples of interprofessional education. And there's lots of different ways we can deliver it. So we can do it through teamwork, we can have subjects. Some universities have a whole subject that's interprofessional education. We can have education seminars, we can have case-based learning where we have people from different professions together. We can use peer-assisted learning when students learn from each other and teach each other. We can have clinical placements where everybody has the same clinical objectives and they're all working together. And we can have things like grand rounds and online learning activities. There's lots of ways we can do it. One of that you can see the picture up there, and this is an example of an interprofessional activity at one university where I work. And the lady in the bed is an actor, and she's playing a patient with delirium. On the left-hand side, you can see a medical student, and on the right-hand side is a nursing student. And the patient has a script, and she plays out a script, and she plays a patient that is becoming more and more confused. And the students together have to work out what is causing her confusion. So they have to assess together, they have to do their roles and work together and work with the patient. And depending on how they work, the patient will become better or continue to deteriorate, because this lady acts in this role all the time, so she knows it very well. So that's one thing that we can do, and it's a very powerful experience. But you can see with all the numbers of students, it can take a long time to do these if you've got one patient, one medical student, one nursing student together. But it's a very powerful learning experience. This is another one that I thought would be of interest to you. So one of the interprofessional activities we set up was an interprofessional emergency birthing simulation. And just to give some context, in Australia, nurses don't do any maternity nursing. So midwives provide antenatal care, intrapartum, labour, postnatal, and after. Nurses have nothing to do with that, nothing to do with childbearing. So we wanted to experiment to see how we could bring nursing, midwifery, and paramedic, and I'll talk a bit about paramedic students in a moment, together to do interprofessional education. Now, in Australia, paramedics are not doctors' helpers. They're professionals, all of their own, that work on pre-hospital care. So they work in ambulances. We don't have nurses in ambulances. We have paramedics who are highly trained, and our ambulances are like mobile intensive care units. So paramedics can intubate, they can do everything they need to do to save a life. So they're very highly skilled professionals. So we set up a scenario of a woman going into labour and the paramedics having to collect her and bring her into the hospital, which was our laboratories. In the emergency department, we only had nurses. We don't have midwives in the emergency department. So she was brought into the emergency department where the nurses had to assess her. And given they don't do any maternity nursing, that was pretty tricky. And they had to call the midwife then to come down to the emergency room. So what it did, it set up a scenario where everybody had to work out their role and play their part. And if I can, so the first bit was the paramedic students brought Felicity, who was the patient, from the ambulance into the emergency department. In the second, they had to hand over Felicity's care to the nursing students, but accidentally the baby was born in the emergency department. So the nurses had to work out what to do. And then the midwifery student came in after the birth and took a handover and then took over the third stage of care. But it was really interesting to watch. And we did this with a lot of students. So this is Felicity. She was the patient. She was also an actor. And she had had many babies before, so she knew about all the sounds to make in labour. She knew all of the phases. She'd had about 5 children of her own, so she knew it pretty well. So she was paid as the actor to play the woman in labour. And we strapped on an abdomen and a birthing simulator. So she actually looked like she was having a baby. So we simulated that. And you can see that there at the side is the paramedic. And at the bottom here, go back. So this is a paramedic. This is a paramedic. And we have 2 nurses here. So at this point, the midwife hadn't arrived. So the lecturers were behind a screen watching behind a window, and the students had to work it all out for themselves. And we video recorded it and they could watch themselves back. So it was a fun exercise. We actually published that paper. So we reported the results and we published that. And we found that students really enjoyed it. They were challenged, they were scared during the scenario because they didn't feel they had the skills they needed. but they understood each other's role and scope of practice much better afterwards. And we could talk about with the videos, we went over the videos with the students again and talked about what they were doing and what they would do differently and what they learned. So they learned a lot. So this is one example of how you can do interprofessional education. There's a whole lot of challenges though, professional education. And I think one of those for us, and I know for Indonesia it's a problem too, is getting all the professions to be wanting to be involved and to participate. It can be challenging to bring everybody together at the right time. And I don't know, I think your curriculum's pretty constrained as well, but finding a place in the curriculum can be tricky because it does take a bit of time. And it's timely, takes time, it's very resource intensive, and some people don't take it seriously. Some people are actually really terrified of the experience, so we need to work through that with them and help them to feel comfortable. We often find that people come in with a stereotype. So as a nurse, I might think a paramedic just picks patients up and brings them to the hospital. I might not necessarily understand all of the things that they do and all their knowledge. And that's where we need to break down those stereotypes. One of the other things that's been highlighted, it's difficult to continue these things because they need people to really continue to rally them and organise them. And it's difficult in some instances to ensure that each profession is treated equally. So one of the things that we would do, and this is probably pitched to the lecturers more than to the students, but one of the things we do in interprofessional education is we actually assess people's teamwork. So we look at how they act in a team, how they function in a team, so that we can assist them to be able to develop those skills. So the team tool is one that was developed in Australia, and it looks at a person's leadership in the team. It looks like at their teamwork and how the team functions. And it looks at how the team prioritises all the tasks they need to do. It's available on the web if anyone wants to use it, but it was developed by some friends of mine and we use that quite a lot. Thank you. That's fine. You can move to the next one. That's great. Thank you. Forward. I think you're going backwards. Oh, it's working now. Okay. So just to finish off, these are the tips for the lecturers. Because being a lecturer and having to implement interprofessional education can also be challenging. And these authors in 2020 came out with 10 tips for facilitating interprofessional education. They suggest that it needs to be structured and introduced early in a curriculum. One of the things that there's been a lot of debate about is, should you do IPE in first year? Should you introduce it at the end of a course? When should you introduce it? And there's a lot of arguments and discussion around that. But these people think you should start early with something simple and then build on it. It's important that the lecturers who are running the IPE also understand the roles of each other. So that can be challenging because often they've come through curriculum that haven't reinforced the importance of interprofessional education. That you build in lots of time for questioning, but the overall focus is not on the student and the student's learning. The focus needs to be on the patient and the patient needs, and then how everybody works together to meet the patient's need. It needs to encourage trust and relationship building. Sometimes the flipped classroom is good because you can have some pre-reading and do some work before you go into an IPE activity. And so you're better prepared to start and to work in that. And the tip, they suggest that you have to be a facilitator, not a lecturer. And by that, they mean you actually have to step away and let the students run things, but only jump in when you're asked to jump in. So rather than teaching, it's facilitating the students to run it. That they encourage peer learning and teaching. And this is a really important thing nowadays in education. Peer-assisted learning means that your peers are teaching you. And many curriculum have peer teaching where the students do the teaching, even in laboratories, that the students teach each other. Because you need to have teaching skills if you're going to work in healthcare, because you're teaching patients and their families all the time. You're teaching students when they come into the clinical setting. So you need to have teaching skills as any health professional. You need to actually step back and review what happened and reflect on it. Did it go well? Did it not go well? What could we do differently? And so on, so that you can change it for next time. And that assessment and feedback fits the activity. For example, it might be peer assessment. So students might assess each other rather than the lecturers doing it. So they're the tips that they suggested. So hopefully that's helpful for the lecturers here. So to sum up, effective interprofessional teams are so vital if we're going to keep patients safe and we're going to have high quality healthcare. Interprofessional education is one way to make that happen by exposing students to working with other health professions as part of interprofessional teams, so that you're used to it by the time you graduate. That you can use lots of different approaches to developing interprofessional education, but for it to be successful, all the healthcare professions need to have shared learning outcomes and to treat each other equally. Finally, that there are tools that we can use to assess the effectiveness of teamwork in interprofessional education. So there are a few references there if anyone wants them, but terima kasih.
Thank you very much, Lisa. Baik, tadi sedikit merangkum ya dari apa yang sudah Lisa sampaikan gitu ya. Jadi bahwa memang kenapa kok Anda sudah mulai dipaparkan interprofessional education itu yang pertama tadi alasannya adalah pasien safety. Nanti di sini semuanya mau jadi tenaga kesehatan ya. Ya, yang pertama adalah pasien safety. Dan nanti Anda akan bertemu mungkin satu kelompok ya. Jadi mungkin di sini ada yang punya kecengan, gebetan dari prodi lain gitu ya. Ntar udah mulai bisa ya. Atau ada yang senyum-senyum tuh. Jangan-jangan ada yang beneran gebet prodi sebelah gitu ya. Nah, mungkin di satu kelompok. Nah, jadi di sini monggo silahkan mungkin sebelum kita masuk ke sesi berikutnya ya. Ada yang mau disampaikan ataupun ditanyakan terkait dengan IPE. Tadi seperti yang sudah disampaikan oleh Ibu Lisa atau Prof Lisa. Jadi nanti Anda akan dipaparkan dengan kasus, kemudian bekerja sama berinteraksi dengan teman dari profesional yang lain. Jadi antar studi program, antar studi gitu ya. Dan nanti ada simulasi gitu. Dan ada Anda diminta untuk memecahkan satu kasus bersama-sama. Nah, ada yang mau ditanyakan dari kelompok sini? Angkat tangan. Ada door prize nggak ini Pak Heri? Kalau ada yang tanya ini. Ada yang tanya belakang? Oh iya, silahkan maju ke depan. Disebutkan nama, program studi dan kelasnya.
Siapa tadi yang
Okay, Prof. Lisa, thank you for your explanation about IPE. My name is Asmar. I'm a midwifery diplomatory program. I have one question about IPE. How about midwifery report in medical record document? When we was a midwife, have interprofessional practice activities with other professions? Example, midwife, nurse, nutritionist, physiotherapy in hospital. Thank you, Prof. Lisa.
The medical record, Ibu Lisa. So how to make kind of the documentation? Okay.
So interprofessional education can be done with any professions that work together. And I was asked last week, I'm going to come over here. I was asked last week when I was talking about interprofessional education is what about, I think there was medical records people, and how do we include them in health interprofessional education? The important thing about getting people working together is that the lecturers need to get together from all of the involved disciplines to develop the scenarios, because you can develop a case, a scenario from anyone that's there, but they all need to be there to understand their role in that. So I think midwives work with lots of different people. Certainly midwifery is very different in Australia. You're very community-based, we're very hospital-based. And so that does make it a little bit harder, but I think it's important to think about the roles and how everyone can contribute to the care of the woman in the long term. And I think here where nurses provide some maternity care as well, I think that there's opportunities for good interprofessional education here.
Ya, jadi sebenarnya perannya bidan dan juga organisasi profesi yang lain itu juga ya masing-masing sudah megang sesuai kompetensinya. Kita tidak perlu membingungkan karena sebenarnya yang paling penting adalah masing-masing profesi itu sadar dengan peran masing-masing gitu ya. Jadi kalau di Australia pendidikan kebidanan, keperawatan ini hanya makan waktu 3 tahun. Jadi selama 3 tahun itu mereka ada yang namanya clinical placement. Clinical placement ini diambil mungkin sekitar waktunya antara 3 sampai 4 minggu aja gitu. Ya, habis mereka menempuh studi 3 tahun, setelah itu mereka lulus, jadi dapat ijazah, baru nanti ambil program registrasi. Jadi registered nurse, jadi registered midwife. Nah, di situ nanti mereka juga akan ketemu dengan berbagai macam profesional kesehatan yang lain gitu. Ya, jadi kalau kaitannya dengan dokumentasi seperti yang dilakukan oleh teman-teman bidan gitu ya. Kalau tadi pertanyaannya kan dari diploma 3 gitu. Ya tetap bisa dilakukan gitu ya, berkolaborasi dengan profesional ataupun yang lainnya gitu. Dari sisi tengah mungkin ada yang mau ditanyakan, silahkan.
Okay, Assalamualaikum warahmatullahi wabarakatuh. My name is Ferdi Firdausi. I'm from anesthesiology program. And now I want to ask to Miss, what is the problem of inhibition interprofessional education? Yes, problem in
The problem in? Oh, problem PE. Okay. The question is about the challenges for interprofessional education, because I think it will be very interesting to be discussed, because you have mentioned about the equality.
Yeah.
Kesetaraan ya. Ini siapa sih ini yang nanti akan charge, siapa yang akan lead gitu ya. Nah, maybe this one you could give more explanation about challenges.
Yeah, it is certainly a challenge for everyone to treat each other equally. And I think a really good example was our experience with the birthing woman. And the paramedics are very, very skilled, and they really didn't understand midwives, and they didn't really think that midwives were very highly regarded until they saw what they did. And when they saw what they did, they said they were amazed at what midwives do, about their knowledge and about the practice. And I think that's one of the things that's why we do interprofessional education. And I think, you know, traditionally paramedics are seen quite high in Australia, and they tend to often look down on others, but they realised actually they developed a respect for the midwives as to how they functioned. And they also developed a respect for the nurses. So you can start out very unequal, but the whole relationship is about bringing people into equal standing. So it might start out that way, but everybody has an important role to play. And when you in a scenario where you have to play out your role, you actually see what others do. And there is so much interprofessional conflict that exists between the health professions. And that's because that people haven't been working and learning together in the past. So I think it is a challenge when you start out, but it can be very beneficial. And that was we saw a huge change in the thinking of the paramedics and the amount of respect they had for others. So it's one of the reasons why we do this.
Ya, jadi tadi satu yang dicontohkan oleh Prof. Lisa adalah tadi mungkin kalau teman-teman lihat ada slide yang ada skenarionya itu ibu bersalin, kemudian Prof. Lisa menjelaskan tentang ada skenario di mana paramedics menghantarkan pasien ibu bersalin, kemudian ketemu dengan midwife, ketemu dengan bidan atau tenaga kesehatan yang lain. Oh ya, ini mungkin belum tahu ya, paramedics itu adalah contohnya gini, kalau di Australia yang namanya driver ambulans itu bukan hanya sekedar driver ambulans saja, tapi mereka itu paramedik sebutannya, gitu ya. Jadi mereka juga sudah dibekali kemampuan kegawat daruratan yang basic gitu, mereka sudah punya. Biasanya kalau tidak salah mungkin sekitar diploma 1 atau diploma 2 gitu. Jadi program vokasi paramedik. Tadi yang dicontohkan adalah kalau kasusnya tadi ada paramedik ketemu dengan bidan, ya bidannya sudah percaya bahwa paramediknya ini pasti akan melakukan pertolongan pertama kepada ibu yang akan melahirkan sesuai dengan kewenangannya. Dan ketika ditemukan ternyata memang pada saat satu kasus gitu ya, paramediknya juga mengapresiasi apa yang dilakukan oleh bidan. Jadi kuncinya adalah di kesadaran bahwa setiap profesi itu punya tugas dan kewenangan masing-masing dan saling menghargai. Jadi satu hal juga yang tadi juga saya catat dan ini sangat bagus sekali ya untuk dipahami oleh teman-teman semua adalah Prof. Lisa tadi dalam satu slide-nya menulis ada kartun yang tulisannya how can they work together if they don't learn together. Bagaimana mungkin tenaga kesehatan itu nantinya bisa bekerja bersama-sama kalau belajarnya nggak bareng-bareng. Gitu. Setuju nggak? Sepakat ya? Gitu. Jadi ini yang harus mulai, kalau yang tadinya mungkin ada dinding-dinding pemisah gitu ya, dari sekarang berarti dindingnya sudah mulai dihancurkan gitu ya. Itu jadi ini pembuka untuk kuliah IPE yang luar biasa kalau menurut saya. Oke, yang selanjutnya mungkin dari sisi sini ada yang mau ditanyakan? Dari sisi selatan, silahkan. Ada yang mau ditanyakan? Nggak ada? Ada lagi mungkin dari sisi tengah atau sisi utara? Oke, silahkan.
Izin bertanya Ibu, mungkin butuh bantuannya untuk ditranslitkan ya. Saya Vinda Pratiwi dari Prodi S1 Keperawatan. Izin bertanya, siapakah yang bertanggung jawab jika ada kesalahan diagnosa atau kesalahan manajemen dalam berkolaborasi antar profesi tersebut? Ya, terima kasih.
Terima kasih Mbak Feni. So the question is who will hold the responsibilities if there is any kind of misdiagnosis or mistreatment during providing the services into the clients or the patients, Ibu Lisa?
So in the context of an
In the context of interprofessional collaboration.
Yeah. In Australia, there's a no blame culture anyway. So So if something happens, it's the team who takes responsibility, not the individual. And it's a culture that, you know, no one gets blamed for things because everybody's working in the team together, that it's the team's mistake. We use errors as learning experiences rather than punitive, and you know, you know, rather than what's the word?
Responsibility.
Yeah, if somebody makes a mistake, we don't they don't get sacked or they don't get a penalty or anything. We work in a culture that's very no blame, and we use errors as learning for future avoidance of errors. Yeah.
Ya, jadi kalau di Australia itu budayanya tidak akan menyalahkan satu orang. Jadi karena ini adalah kerja tim, gitu, ya. Mereka memanfaatkan yang namanya setiap tugas sehari-hari errands ya, itu sebagai proses belajar. Jadi kalau toh misalkan ada kesalahan, maka ya ini adalah kesempatan untuk belajar lagi. Jadi ini budayanya kalau di Australia ya, dan tidak ada penalti, tidak ada hukuman yang dibebankan kepada individual, tetapi ini adalah tanggung jawab tim gitu. Dan so instead of penalty, is there any kind of punishment or anything for the teams who
No.
Ya. Tidak ada hukuman untuk tim yang mungkin pada saat itu melakukan misdiagnosis atau mistreatment gitu. Tuh ya. Oke, menarik ya. Nih ya, ada yang pengen pindah ke Australia? So I asked them, are there any student want to move to Australia there?
If there's an error, the hospital takes the responsibility. So they see their responsibility to retrain people and to upskill them if their skills are lacking.
Ya, jadi tanggung jawabnya ya dipegang oleh rumah sakit gitu, bukan individual profesionalnya gitu ya. Oke, mungkin ada lagi yang mau ditanyakan? Ada di sini? Masih ada yang mau ditanyakan? Silakan angkat tangan tinggi-tinggi. Mungkin dari ibu dosennya, Bapak. Silakan, masih ada? Oke, masih ada satu lagi.
Oke, Assalamualaikum warahmatullahi wabarakatuh. My name is Sokonole Prawitra. I am from nursing class in C3. Okay. My question is in patient safety. According to the data in the PowerPoint, Mrs. Lista, research conducted in the US from 1905 to 2005, so that effective team communication was the main cause of nearly 66% of all medical errors during that period. And we know that everyone's nature is different. There are introverts, there are extroverts. It's impossible in one team all extroverts or all introverts. It's impossible for everyone to nurse who has an introverted nature to improve her communication skills. And that suggestion may solve the problem or reduce the percentage of this problem in the future. Maybe that is my question. Thank you.
Good question.
Can you restate it? Because it was a bit muffled.
So you have mentioned on your slide that the biggest cause of error during the teamwork are about the communication.
Yeah.
So he asked whether any other way to improve the communication skills of healthcare professionals or healthcare students, because everyone is unique in their own way. They have different way of communicating. Introvert and extrovert are very different people. So yeah, do you have any suggestion for them?
That's a really good question, and I think there's lots of ways. Communication's really hard to teach. Like we do have communications in courses, but it's really hard to teach. And what I encourage people to do is to watch other health professionals communicating with each other. And when they do it well, to use that role modeling to actually get a sense of what's required. So watch the, when you're in clinical placement, you're really focused on tasks, but you need to step back a little bit and do more observation as well. Look at how people interact. Learn from the bad interactions as well as the good ones. You'll be able to judge them. See how people use their body language in their communication. Because communication is not all about verbal, it's also about the non-verbal communication. And that's very culturally bound. And I know with my students, we have students from very many cultures, and many of them struggle with that, especially if they come from societies where you don't have eye contact. Those sorts of things can be really challenging. So we spend a lot of time talking about communication because our students come from lots of different backgrounds. But I think if you can watch how professionals communicate, and particularly the good ones, I think that's one way to help you develop your own communication skills.
Jadi kuncinya adalah punya role model, ya. Jadi punya role model, mungkin lihat bagaimana caranya dia berkomunikasi. Bahkan tadi disarankan juga supaya kita mungkin mundur ke belakang untuk bisa mengobserv dulu. Sebenarnya bagaimana sih caranya gitu ya. Yang bagus seperti apa, karena setiap individu tadi berbeda-beda. Jadi mungkin memang pada saat nantinya Anda ada clinical placement ataupun internship atau magang gitu ya. Pasti tantangannya adalah ketika Anda berkomunikasi di tempat yang baru, ketemu dengan orang yang baru. Makanya ada yang namanya proses clinical placement itu ya pasti memang ada tahapan-tahapannya. Anda observasi dulu, ini yang mana nih ibu yang galak gitu ya. Ini yang mana sih ini ibu yang cerewet gitu. Mana sih A yang enak diajak ngobrol. Mana sih A yang orangnya kaku gitu ya. Dan masing-masing dari orang tersebut pasti punya cara berkomunikasi masing-masing gitu ya. Dan ada beberapa juga yang memang bahkan kalau yang pernah dihadapi oleh Ibu Lisa adalah pasiennya ataupun orangnya gitu ya, nakesnya atau mahasiswanya itu berasal dari mereka yang punya budaya tidak boleh melakukan kontak mata gitu. Jadi godul basor. Nah, gimana lah itu ya. Jadi kalau misalkan mau godul basor gitu ya dengan klien, dengan dengan kolega yang lain, nah itu juga mungkin juga salah satu strategi. Jadi yang paling utama adalah cari role model. Gitu ya. Makanya kalau pada IPE ini salah satunya tadi juga yang harus digarisbawahi adalah leadership atau kepemimpinan. Oke, ada lagi sebelum kita tutup? Mungkin satu pertanyaan lagi? Masih ada? Oh, ada satu lagi. Oke, silakan.
Baik, Assalamualaikum warahmatullahi wabarakatuh. Pertanyaannya adalah, apa yang menjadi tantangan para tenaga medis untuk menerapkan kolaborasi dan kualitas pelayanan kesehatan, Ibu?
Again, the question is about the challenges for the healthcare students and healthcare professionals to collaborate with others to improve patient care. Yeah. So what are the challenges?
So what are the challenges? I think the challenges are that even if you want to communicate with somebody, they might not want to communicate with you. So I think that can be a challenge. I think, yeah.
So the challenges for the healthcare professionals to do the collaboration.
Yeah. Okay. So the it's about getting people together at the same time to really sit down and discuss the patient, what the goals are, to share the goals for that patient. That's one of the challenges. Particularly when doctors come in very quickly and they go again, that can be challenging to get them involved. But in our care, we try to do team-based care. So we might organise at 1 o'clock, we're all going to have a meeting to talk about this patient, and we're all going to work on shared goals and work out who's going to do what parts of care. So it's challenging in getting people together. We know that obviously health professionals are really busy and really time poor. So it's how do you make that time? That's one of the challenges as well. And I think it's educating people about the importance of working in teams to actually communicate. Once people are involved in team-based care, they realise its importance and they realise why you do it. So it's about getting people engaged in it and wanting to be involved in that approach to care.
Lagi-lagi Ibu Lisa menyampaikan tentang komunikasi ya, bahwa mungkin kita komunikasi sama orang tapi orangnya nggak pengen komunikasi sama kita. Ada juga di mana memang waktu ya, tantangannya mungkin waktu. Kita tahu bahwa yang namanya tenaga kesehatan itu kan nggak ada yang nggak sibuk. Dokter datang, visit, kemudian langsung keluar gitu ya. Jadi mau memberikan penjelasan seperti apa sebenarnya gitu ya. Jadi terutama memang yang paling berat adalah itu, ditambah satu lagi adalah memberikan pemahaman bahwa sebenarnya goal dari kolaborasi tim ini adalah luaran ya, jadi kualitas layanan kesehatan yang optimal untuk klien. Jadi mengkomunikasikan pentingnya IPE ataupun IPC gitu ya, Interprofessional Collaboration, itu sebenarnya juga yang merupakan tantangan. Makanya bersyukur ya, ini Anda sekarang kuliahnya di Unisa dan memang ada modul khusus untuk IPE, dan mungkin ini di institusi lain nggak ada ya Bu Nurul ya? Nggak ada. Jadi Bu Nurul Kurniati ini Kaprodi D3 Kebidanan, itu beliau merupakan penanggung jawab modul IPE ya, Interprofessional Collaboration. Ini nggak ada kalau di institusi lain. Jadi ya memang sudah mulai dibekali dari sekarang. Mungkin itu ya, itu cukup ya. Oke, ingat sih nah. Alright, thank you very much for everyone. So I would like to sum up a little bit. Jadi saya akan men-summary sedikit ya, meringkas sedikit bahwa yang namanya tantangan dalam pelayanan kesehatan itu sebenarnya sangat banyak sekali, di mana salah satunya ya dengan adanya berbagai macam penyakit kronis, kemudian adanya epidemik, kemudian ada krisis kemanusiaan, ada juga masalah kesehatan mental. Ujung-ujungnya yang paling harus kita perhatikan tadi adalah patient safety, jadi keamanannya si pasien. Dan salah satu upaya untuk meningkatkan patient safety adalah dengan bekerja secara berkolaborasi dengan tenaga kesehatan yang lain. Apa itu IPE? Sebenarnya IPE ini adalah, atau Interprofessional Education, itu adalah salah satu aktivitas dalam proses pembelajaran di mana melibatkan 2 atau lebih profesional kesehatan yang saling belajar. Jadi bukan hanya perawat belajar ke bidan, tetapi ya bidan juga belajar ke perawat, belajar juga dengan perawat anestesi, mungkin nanti belajar dengan prodi gizi gitu ya. Anda saling belajar. Jadi kata kuncinya adalah ketersalingan, ada salingnya gitu ya. Karena prinsipnya dalam menerapkan IPE harus punya tujuan meningkatkan kualitas pelayanan kepada pasien gitu. Dan memang keuntungannya itu sebenarnya sangat banyak sekali ya. Jadi yang jelas ya dalam hal ekonomi otomatis kalau luarannya baik, kesehatannya pasien akan lebih optimal, maka ya akhirnya kualitas hidup masyarakat Indonesia ya yang tentunya juga akan sangat terpengaruh. Ditambah dengan memang ada beberapa tantangan tadi ya, ada teamwork, kemudian ada komunikasi, kemudian tujuan atau goal yang memang mau dicapai. Ada beberapa cara ya untuk menerapkan IPE, mulai dari simulasi, team based learning, kemudian bahkan formal IPE subject, jadi modul interprofessional edukasi yang memang secara formal gitu masuk dalam kurikulum gitu ya. Ada case based group dan ini luar biasa. Nantinya ini mungkin juga bahan presentasinya Prof Lisa akan dijadikan bahan untuk Bu Nurul dan tim untuk bisa merancang nanti penilaiannya akan seperti apa untuk IPE gitu. Karena tadi ada penilaian IPE macam-macam. Itu saja mungkin yang bisa kami sampaikan. Kita kasih tepuk tangan, aplaus keras mungkin untuk Prof Lisa. Ya. Terima kasih. Kami kembalikan kepada MC.
All right, thank you so much, Ms. Jessa and Prof. Lisa, for the great lecture today. Okay, all right, audiences, let's give our moderator and lecturer give big round of applause again. All right, all the students of Universitas Aisyah Yogyakarta, the next agenda is gift giving that will be given by Mr. Hari Puspito, Magister Kesehatan Masyarakat, that will be given to Prof. Lisa McKenna. To Mr. Hari Puspito, I will invite you to the stage to give the gift to Prof. Lisa. All right. And then we will continue it with the photo session. All right. Okay, and then we will continue it with the photo session. So I would like to invite Prof. Lisa to come forward here to take picture together with all the students. All right. Okay. Okay, I would like to invite Prof. Lisa to be in the middle of the stage around here. Yeah. Okay, and also I would like to invite to all students to stand up. To stand up, please, and yeah. Yep. Okay, if the students want to be in the side of our lectures, it will be pleasant. Okay. Oke, teman-teman yang mau ikutan foto yang di tengah bisa langsung ke depan sini terus merapat ya biar semuanya bisa kelihatan. Yuk, yang di sebelah sini mungkin mau ikutan foto silakan. Lumayan mampang di Instagram nanti. Alright. Oke. Yang ada di belakang mungkin bisa sambil lambai-lambai tangan gitu ya biar bisa kelihatan semuanya di kamera. Oke. All right, let's give applause again. Oke, karena masih ada yang meminta foto, jadi saya persilahkan terlebih dahulu ya, karena mumpung kapan lagi seperti itu. Iya, oke, just feel free guys to take a picture.